and thank you AFPA for giving me this opportunity. So today we will discuss regarding the basics of the lung cancer. As lung cancer is a very complex disease, and sometimes not only the medical oncologist, but we require the multidisciplinary team, including the surgical oncologist, the radiation oncologist, radiologist, as well as molecular pathologist for the treatment plan of the patient, because every patient of the lung cancer that has been treated in a different way. So this presentation is an attempt to simplify this complexity of the lung cancer management. So before knowing the lung cancer, we must know the basic anatomy of the lung. That is necessary for the staging purpose, and that is also necessary for the surgical purpose. So as we all know, trachea bifurcate into two main bronchus, and this bronchus on the right side is differentiated into three primary bronchus, and based on that, right side has upper, middle and lower lobe, while the left side of the lung has only upper and lower lobe. Why it is important to know about the lung cancer? That is because according to the Globocon 2020 data, lung cancer is the second most common cancer worldwide. And when you see the mortality, the lung cancer is superior. It is the first most common cancer that is causing the death. And that is why knowing the lung cancer, it is important. When you see the data in India, lung cancer is the fourth most common cancer. But when you see the mortality, almost 80% of the lung cancer patients die annually. And when you see the breast cancer, almost 50% of the breast cancer patient can survive. So lung cancer is having the worst prognosis, and that is why the newer or recent advances that has been necessary for the diagnosis and the treatment of the lung cancer. Why this higher mortality occurs? That is because majority of the lung cancer that has been diagnosed, almost 60% of the lung cancer that has been diagnosed with stage 4 disease, very advanced disease.
Sir, sorry for the disturbance. Just a message for the audience that from you earlier I received. Maintain your silence, please, as the speaker is revealing session. Sorry for the interruption. So, thank you.
Thank you, sir. So these are the causes and the risk factors of the lung cancer. The most common cause of lung cancer is the smoking. So almost 80 to 90% of the lung cancers that is occur because of smoking. Sometimes the patient may ask that relatives will ask that the patient is non-smoker, or the lung cancer has been occur in a female patient that is non-smoker. So why that happen? That happened because of second-hand smoke. That is the gift given by her husband to her. This is because of second-hand smoking. So majority of the lung cancer is because of smoking. Almost 85% of the lung cancer is because of smoking. Other causes, they are occupational hazard, including the asbestos exposure, arsenic exposure, or indoor air pollution due to radon. Sometimes the chronic obstructive lung diseases or interstitial lung diseases long-term, that is also causing the lung cancer. Now, what are the clinical findings that that you may suspect that this is the lung cancer? So majority of the signs and symptoms of the lung cancer, they are very haphazard. They are overlapping with the other diseases of the lungs. The signs and symptoms of the lung cancer, they are divided into two parts. One is the localized because of the involvement of the lung, and second is generalized because of the metastasis. So these are the commonest symptoms of the lung cancer: persistent cough, shortness of breath, hemoptysis, or chest pain. This is because of involvement of the lung or pleural effusion. Generalized symptoms here: weight loss, or shoulder, arm or chest or back pain. That is because of involvement of the bone metastasis. Majority of these symptoms, they are overlapping with the other diseases. So if these symptoms, they are persistent, chronic, and they are unexplained by the other diseases, then you should suspect the lung cancer. And after this persistent and unexplained symptoms of lung, you should do the investigation. The first aim of investigation is to diagnose the lung cancer. Second aim is for the staging, and third is to decide the treatment. So we will look one after one. First, you should do, when the patient presented with these symptoms, you should do chest X-ray, and this is the typical picture of lung cancer. In this chest X-ray, there are speculated margin, lung mass with the speculated margin. Speculated margins are there because the periphery of the cancer, periphery of the tumor has more growing cells as compared to the center of the tumor where necrosis is more. After seeing this picture in the chest X-ray, you should do CT thorax. In CT thorax, you can diagnose the extent of the disease. You can see what is the size of the tumor, and what is the involvement of the other organs. And after CT scan, you can also see the speculated margins in the cross-sectional CT. And after CT scan, when you find the lung mass, you should do biopsy for the confirmation. That is 100% confirmatory. So biopsy you can do based on the location of the disease. So before biopsy, you should do CT scan. If the location is in the central part involving the hilum, you should do bronchoscopy guided biopsy. And if the location is on the peripheral side of the lung, you should do CT guided or image guided biopsy. So based on biopsy, the lung cancer that has been divided into two parts, the primary lung tumors or secondary due to metastasis. We will focus on primary lung tumors. The primary lung tumors are two types. One is the small cell lung cancer and second is the non-small cell lung cancer. And this non-small cell lung cancer that has been divided into three parts, adeno, squamous or large cell cancer. So how we will differentiate based on biopsy? So biopsy is inadequate for differentiating between these tumors. So we need to do the immunohistochemistry, or called as a ISC, based on the protein markers. So after confirming that on biopsy that there is a lung cancer, we should do the staging. So investigations for the stagings are two most important investigations. One is a PET-CT to see the involvement of the other organs. Most common metastatic site in the lung cancer is the bone, brain, liver and adrenals. So apart from the brain, PET-CT is fair enough to diagnose the metastasis in the other organs, but in the brain, the sensitivity of the PET-CT is very low, and for that, you should do MRI. So this is the typical picture in the MRI, the temporoparietal lobe metastasis of the lung cancer. And last important thing for the staging, when the disease, the lung cancer disease is localized, in that scenario, you should do before proceeding for the surgery, you should do mediastinal staging by using the endobronchial ultrasound or using the mediastinoscopy. And after this workup, we stage the lung cancer based on the TNM staging. So T staging is dependent upon the size of the tumor as well as the extent of the disease, involvement of the other structures, nearby structures. N staging dependent upon the lymph nodal involvement, either a hilar or a mediastinal lymph nodes are involved or not, or supraclavicular node are involved or not. Based on that, N1, N2, N3 staging has been done, and M1 or M0 based on distant metastasis. And based on that, we do the staging of the lung cancer. And last part for the investigation is to decide the treatment. So before proceeding for the treatment, we must do the spirometry, 2D echo for the cardiorespiratory evaluation, and the fitness of the patient. And last but important thing is the molecular testing. We will see later on. Now comes the treatment part of the lung cancer. What are the treatment for the cancer? Three basic treatment of the cancer. One is surgery, second is radiotherapy, third is systemic therapy. Systemic therapy including chemotherapy, targeted and immunotherapy. We will see one by one. This is the basic landscape of the treatment of the lung cancer. So early stage of lung cancer should be treated with the surgery or a radiotherapy, and advanced stage of the lung cancer should be treated with the systemic therapy. And these are the type of surgery required in the localized lung disease, either a segmental resection or a wedge resection, or you can do entire lobe you can remove if tumors are large enough, lobectomy, and pneumonectomy we are not practicing nowadays. Radiotherapy, two types. One is image guided radiotherapy and SBRT. We will not focus on that. We will focus on systemic therapy because majority of the lung cancer, almost 80%, they are presented with very advanced disease, and that's why systemic therapy is necessary. So we have already discussed how the lung cancer that has been differentiated based on histopathology, but now histopathology also is not enough. Lung cancer is now divided on molecular markers based on which mutation that has been detected in the lung cancer. We will treat that. So first part of systemic therapy is a chemotherapy. We all know chemotherapy that acting on various phases of the cell cycle and that causing the cell cycle disruption, causing the cell death. There are multiple types of chemotherapy. They are acting on multiple part of the cell cycle, but there are some issues with this chemotherapy. One is major issue is the toxicity. Chemotherapy is highly toxic, affecting the other cells of the body. It causing the hair loss, it causing the myelosuppression, it causing the other organ damage. Second important thing with chemotherapy is that it can induce the new mutation in the cancer, and that is why, like bacteria that has been resistant to the antibiotics, the tumor cells will become resistant to the chemotherapy drugs. And the last important thing is chemotherapy is not suitable for the elderly as well as frail patients. So what will do in that patients? There comes the role of targeted therapy. Targeted therapy is very different from the conventional chemotherapy. This targeted therapy, they are acting on the specific proteins on the surface of the cancer cells. And that is why the difference between chemotherapy and targeted therapy, chemotherapy is like a machine gun. It can act on the normal cells of the body as well as tumor cells. But targeted therapy is guided missiles, specifically act on the cancer cells, it targeting the cell proliferation, cell survival, angiogenesis and other nuclear factors. And these are the approved targeted agents in the lung cancer. So almost 60% of the lung cancer patients, there are some mutations, and for that there is the drug available. So only 30% of the patient with advanced lung cancer patient require chemotherapy, and these are the number of targeted agents that has been available only for the lung cancer. And this list that has been downloaded 3 days back, perhaps this guideline might be changed today and one new molecule will be added. So it is constantly developing field. And these are the trial data that suggest when you treat this patient previously with only chemotherapy, the survival is only 6 to 7 months, and now we can increase the survival in stage 4 lung cancer 4 times that as compared to chemotherapy with targeted or immunotherapy. Now comes the last part, which is the immunotherapy. Now, as we all know, the immunotherapy, the immunity of the body that will prevent the development of the cancer in the body. T cells having 2 receptors. One is co-stimulatory receptors and second is co-inhibitory receptors. What happens in the tumor? The tumor cells that causing the inhibition of stimulatory receptors and causing the activation of inhibitory receptors. And that is why the tumors that escaping this our innate immune mechanism. So what the immunotherapy do? Immunotherapy that inhibiting this inhibitory signals, and that is why it can cause activation of our own immunity against the cancer. These are the immunotherapeutic drugs that has been available. These are all the tongue twisters names, but these are already approved, available in India for the lung cancer, and with that we can increase the survival of the stage 4 even early stage lung cancer. And this is the landscape of treatment of lung cancer. Basically those tumors which are more than 3 centimeter or node positive, we must do chemotherapy with immunotherapy followed by surgery, and in advanced stages based on the molecular profile we must treat this patient according to the mutations. If no mutations found, we will do the PD-L1 testing, and based on that we will do immunotherapy. If immunotherapy is not patient is not a candidate for the immunotherapy, then we will treat this patient with chemotherapy.
So 1 minute left.
Yes. So this is the take-home message for today's lecture. Treatment of lung cancer patient that has been highly improved, is improving day by day. Chemotherapy, although it is a backbone for the treatment of the lung cancer, but it has its own toxicity, and that is why targeted therapy is a newer way to treat these lung cancer patients. It has lower toxicity, it has higher efficacy, and the understanding of the underlying biology of the lung cancer as well as the molecular subtypes that has been necessary in lung cancer to improve the outcome and the increasing the overall survival of these patients. So entire presentations is kept on one side, and this slide is on it should be kept on one side, because majority of the lung cancer, it is because of smoking, almost 80 to 85%. The role of general physician or a family physician is to counsel the patient as well as family member to stop the smoking, because 80 to 90% of the lung cancer that can readily prevented, and nothing can replace the smoking cessation. So thank you so much.